And good evening, everyone. This is my affirmative restatement regarding national healthcare insurance. Judge, audience, and fellow debaters. After hearing the opposition's rebuttal, the affirmative still stands firm. We've shown that the current healthcare system causes real, measurable harms, and that those harms are structural and persistent, and that a national healthcare insurance program is the only plan that delivers both solvency and equity. So let's walk through the key issues again: the harms, the insolvency, the inherency, the plan, and advantages, while addressing some of the opposition's concerns. The harms. So, why does the status quo fail? Millions of Americans are either uninsured or underinsured. Those with coverage face crippling deductibles, skyrocketing copays, and policies that vanish when they get sick or change jobs. Families delay or skip care. Rural hospitals close. Seniors ration essential medications, and preventable deaths continue. Problem isn't isolated or accidental. It's baked into the system and the structure of a multi payer, profit driven system. Fragmentation causes confusion, administrative waste, and unequal access. Opponents may claim that the system can be fixed with targeted reforms, expanding Medicaid here, offering state level subsidies there, but decades of partial fixes prove that the harms will persist without federal action. Next, we'll cover inherency, why this problem will not fix itself. Private insurers are designed to maximize profit by limiting coverage, denying high risk patients, and raising premiums. They are not equipped to provide universal care. State level solutions are inefficient and insufficient. Budgets are limited and results are inconsistent. Even federal programs like Medicare, Medicaid, and the ACA are fragmented, covering different populations under different rules. The current system inherently leaves gaps, traps families in medical debt, and punishes people for getting sick. Without a comprehensive national plan, these problems will continue. And next, on to solvency, how this plan actually works. Our plan doesn't promise perfection, it promises progress. Single national payer system consolidates funding, eliminates duplicate administration, reduces private profit overhead, and allows the federal government to negotiate fair prices for drugs and procedures. Opponents worry about bureaucracy, but the truth is, we are already mired in bureaucracy. Millions of hours are spent on paperwork, authorizations, and appealing denials. Replacing the fragmented system with a unified system reduces red tape, it does not increase it. Opponents also fear economic shock or job loss. But jobs are not destroyed, they're repurposed. Administrative workers transition into claims management, patient navigation, and public health roles, while expanded access creates demand for more doctors, nurses, pharmacists, and allied health professionals. We don't need to reinvent the system. We build on existing success. Like in Medicare expanding coverage to all Americans, this phased approach would allow insurers and employers and providers time to adapt. So the plan is rational, it is achievable, and it is funded. The federal government, through Congress, will guarantee health insurance for all U.S. residents. It would be funding with reallocation of existing federal and state healthcare spending, employer payroll contributions, and modest progressive taxation if necessary. A new division within HHS would coordinate these benefits, negotiate prices, and reimburse providers. Essential services, including preventative care, primary care, hospitalization and emergency services, prescriptions, and mental health care, would all be covered under a national plan. Implementation would be rolled out in phases, which would protect stability, keep existing providers, and expand rural and underserved areas. The advantages to this are very clear. With improved public health, everyone could access preventative care and early treatment, which would reduce disease progression and preventable deaths. Economic relief and efficiency, administrative savings would reach hundreds of billions annually, freeing resources for patient care. Families face fewer out of pocket costs, and businesses can invest more in wages and hiring. Healthcare access no longer would depend upon income, geography, or employment. Rural hospitals are stabilized, marginalized communities receive fair care, and mental health coverage becomes comprehensive. The expanded access and new public health programs would create more healthcare and administrative jobs while repurposing existing workers into roles that improve patient care. Opponents ask if national health insurance is realistic. I ask, how long can we afford not to act? We already spend enough to fund this plan. The problem is not a lack of money, but a lack of inefficiency and inequity. The affirmative plan consolidates spending, reduces waste, protects jobs, expand access, and builds a fair system. Healthcare should not depend on luck in income or employment. It should depend on our humanity. And it's for these reasons that I urge you to affirm this resolution.